What do I need to know about Medicaid for high school students, for parents, students, and school professionals? Presented by Granite State Independent Living's Financial Planning and Benefit Services. What is Medicaid? Medicaid is a federally subsidized health insurance program administered by the state of New Hampshire that provides medical coverage to low-income individuals and families who need assistance paying for health care. Medicaid provides coverage to families, children, and people with disabilities. What kinds of Medicaid are available to high school students under age 18 with disabilities? There's Children's Medicaid, also known as CM. This was formerly known as Healthy Kids Silver and Gold in the state of New Hampshire. There are also some special categories of coverage. There's Katie Beckett, or Home Care for Children with Severe Disabilities, which is also known as HCCSD. There's Children with Severe Disabilities, also known as CSD. There's Home and Community-Based Care for In-Home Supports, and this is known as HCBC-IHS. And there's Home and Community-Based Care for People with Developmental Delays, and this is known as HCBC-DD. Who is eligible for Children's Medicaid? You must be under age 19, and Children's Medicaid eligibility is also based on household size and income. In addition, you do not have to have a disability to be eligible for Children's Medicaid. What kinds of things does Children's Medicaid cover? It provides free medical and dental care to high school students who qualify. What is Home Care for Children with Severe Disabilities, also known as HCCSD? This program is also known as the Katie Beckett Program. It provides special coverage for severely disabled children up to age 19. The children must qualify for institutional care, but they're being cared for at home. The cost of caring for the child at home must not exceed the cost of caring for the child in an institution, and only the income and resources of the disabled child are counted toward financial eligibility for this program. What is Children with Severe Disabilities? CSD is a special coverage for disabled students under 18 or through age 19 if they are attending high school or its equivalency full-time. The disabled student does not have to be living with a parent or relative to be eligible for this program. What is Home and Community-Based Care and Home Supports, also known as HCBC-IHS? IHS offers a variety of community-based services that a developmentally disabled student may need in order to prevent institutionalization. This program is focused on supporting families and children with disabilities. The child with a disability will need help with the activities of daily living or nursing care. In addition, the family must have obstacles that make it difficult for the parents to appropriately care for the child without assistance. This can be obstacles on the parent's part or obstacles on the child's part. The high school student must be under age 21, they must meet income and resource limits, they must be eligible for area agency services, they must live with their family at home, and they would be institutionalized if not for HCBC-IHS services. As long as the student's income is under $2,130 per month, there is no out-of-pocket expense for these services. What is HCBC-DD? And again, this is Home and Community-Based Care for People with Developmental Delays. HCBC-DD offers a variety of community-based services the developmentally disabled student may need in order to prevent institutionalization. There is no age limit for HCBC-DD, but the student's developmental disability must have begun before age 22. In addition, certain services through this program, including personal care, residential services, and day services, are not available until the child turns age 21. In order to be eligible, the high school student must be eligible for area agency services, they must meet income and resource limits, and they would be institutionalized if not for HCBC-DD services. What types of Medicaid are available to high school students over age 18 who have disabilities? There are several programs available. There is aid to the permanently and totally disabled, also known as APTD. There is aid to the needy blind, also known as A&B. Both APTD and A&B also have cash assistance categories in addition to Medicaid categories. So somebody who is categorically needy, eligible, meaning that they receive cash assistance, is also eligible for Medicaid through these programs. There's also In and Out Medicaid, which is also known as Medicaid with a spend down. There's Medicaid for employed adults with disabilities, known as MEAD. And there are several special categories of coverage, including more home and community-based care waivers and 1619B Medicaid protection. What is aid to the totally and permanently disabled, Medicaid, and cash assistance? APTD provides Medicaid coverage to students with disabilities who qualify. This program also provides cash assistance to certain low-income students who qualify. If you qualify for cash assistance, you automatically qualify for Medicaid through APTD. Who is eligible for APTD, Medicaid, and cash assistance? The requirements for eligibility: you must be between the ages of 18 and 64, have a medical condition expected to last at least 4 years or result in death, not be earning over substantial gainful activity (SGA) of $1,070 per month at the time of application, have resources below $1,500 cash or $2,500 for Medicaid, and for cash assistance you must also apply for Social Security benefits. What is Aid to the Needy Blind? This program is also known as A&B. It's a Medicaid and cash assistance program for people who are visually impaired. It's the same rules with cash assistance and automatic eligibility for Medicaid as it is with APTD. Who is eligible for A&B? It's the same eligibility guidelines as APTD, Medicaid, and cash assistance, with the following exceptions. The person must be legally blind, and you can be any age to qualify for A&B. What is In and Out Medicaid? This program provides coverage to students who do not meet the income limits for cash assistance for APTD or A&B Medicaid, but the other requirements still apply. So if you meet all of the other requirements for either APTD or A&B Medicaid and cash assistance, but you don't meet the income limit, your income is higher than that limit, you may be eligible for In and Out Medicaid. The In and Out part refers to the fact that a student must requalify for Medicaid each month on this program, and a spend down amount is determined for each student on this program. Who is eligible for In and Out Medicaid? Individuals who do not meet the income limit for cash assistance for APTD or A&B Medicaid, they can qualify for this program. You must have income over the protected income limit of $591, and you must have resources below $2,500, and you must also be otherwise eligible for Medicaid. What is a spend down? A spend down is how much has to be received in unpaid medical expenses before Medicaid will begin coverage for that month. For example, a $100 spend down means that the individual must have acquired $100 in unpaid medical expenses before Medicaid will begin coverage for the month. Even if the $100 is not accrued until the last day of the month, that is the soonest that Medicaid will begin for that person. And as I said before, Medicaid In and Out starts over every month. So even if you don't become eligible for Medicaid until the 30th of June, on July 1st, you start over again, and you're not eligible again until you accrue $100 in unpaid bills for July. And the way that a spend down is calculated is it's the difference between the person's countable net income and the protected income limit of $591, which is set by the state. So if someone's countable net income is $750 and the pill is $591, their spend down is $159 per month. What is Medicaid for employed adults with disabilities? It provides coverage to individuals with disabilities who have employment. Individuals on MEAD can have higher incomes and resources and still receive Medicaid coverage. Depending on your income, you may have a premium. If you are on a HCBC program and are also on MEAD, you will not have a cost of care. Who's eligible for MEAD? The requirements for eligibility: you must be between 18 and 64 years old. You must be employed or self-employed for pay. You must be paying FICA and related taxes. And so if you're working for an employer, those are the taxes that come out of your check every 2 weeks or every week, however often you're paid. If you're self-employed, those are the taxes that you pay yourself at the end of the year on your federal income taxes. You must meet the medical eligibility for Medicaid in New Hampshire, and in this case, that means you must have a disability that meets the criteria. And you must meet the monthly income limit of up to $4,309, and that's net income, and the resource limit of up to $26,754. Can you tell me more about the HCBC waivers? Once you qualify for medical assistance under the Medicaid program, you can also qualify for a Medicaid waiver under the Home and Community-Based Care programs, also known as HCBC. There's several different categories. There's Choices for Independence, also known as HCBC-CFI. There's Developmentally Disabled, also known as HCBC-DD. And there's Acquired Brain Disorder, also known as HCBC-ABD. These HCBC Medicaid waivers provide additional coverage and services for these specific populations. And depending on the student's income, there may be a cost for these services, and that's known as a cost of care. What if I receive SSI? What happens to my Medicaid if I am working and I earn enough money that I no longer receive an SSI benefit? 1619B is Medicaid protection for SSI recipients who earn enough to zero out their cash payment. With 1619B Medicaid, when an individual's SSI cash payment stops, their Medicaid coverage will continue. So technically, you're still eligible for SSI in this case, even though you're not receiving a check. You haven't been terminated, you haven't been suspended, you're still eligible. 1619B keeps the individual tied to SSI, so if your earnings drop low enough, the SSI cash benefits will begin again with no need to reapply. So that's really nice. So if you're worried that you might have a reoccurrence of your disability, or even if you're afraid you might lose your job, you can keep your tie to SSI and get that benefit back if you need it. This protection can be accessed through any Medicaid program as long as the requirements are followed. And you can find more information on 1619B under the What Happens When a High School Student Receiving SSI Goes to Work presentation on this website. I'm a high school student turning 18 soon. What changes happen with my Medicaid when I turn 18? Students who receive Children's Medicaid should apply for APTD Medicaid when they turn 18, and you can apply for up to 3 months prior to your 18th birthday. Students who receive CSD Medicaid should apply for APTD Medicaid when they turn 18, or when you turn 19 if you attend high school full-time. What if I'm receiving HCCSD Medicaid? The state must notify the parent or representative of a child who is receiving the Medicaid through the Katie Beckett program of the availability of APTD Medicaid 3 months prior to the child turning 18. If APTD Medicaid is not requested, HCCSD Medicaid coverage will terminate at 19 years of age. What if I'm receiving HCBC-IHS? When you are within 3 months of turning 21, you should work with the area agency to transfer to another HCBC program. Most often, the appropriate HCBC program will be the HCBC-DD program. If you do not request a transfer at age 21, you will no longer be eligible for HCBC services until you reapply through your area agency or Department of Health and Human Services. I'm on HCBC-DD. Do I need to do anything when I turn age 18? HCBC-DD is available to people of all ages as long as they are medically eligible. So when you turn 18, you do not need to transition to a different HCBC program. However, you will still need to transition to a different Medicaid program in order to continue eligibility. In most cases, this means transitioning to APTD Medicaid. If you want more information, you can view the rest of the videos on this website to learn more. You can contact Granite State Independent Living for assistance at 877-809-7028 at www.gsil.org, or you can email benefits@gsil.org. You can visit the New Hampshire Work Incentive Resource Center for resources, and the website is www.nhwirc.org. You can contact the Social Security Administration or New Hampshire's Department of Health and Human Services. Social Security Administration website is www.ssa.gov. The Health and Human Service website is www.dhhs.state.nh.us. And if you are connected with an area agency, mental health center, or vocational rehabilitation, you can contact them for more information and assistance.